This episode of the ABIC podcast is brought to you by Cynosure Australia. Hello and welcome to the ABIC podcast, your online support community for the aesthetic and beauty industry. Here, we're strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is the ABIC podcast. I'm your host, Stephanie Miller, and today's guest is Dr. Davin Lim from Cutis Dermatology on behalf of Cynosure Australia. Dr. Davin Lim is a distinguished dermatologist renowned for his exceptional expertise and dedication to advancing the field of laser and procedural dermatology with a particular focus on pigmentary conditions. Dr. Lim's extensive training in the United States, Asia, Australia, and the United Kingdom has equipped him with a comprehensive understanding of dermatological principles and techniques. With a prolific career spanning both national and international platforms, Dr. Lim has made significant contributions to the field through his publication of over 40 peer-reviewed papers and his role as a lecturer. His commitment to patient-centric care is evident in his clinical approach, which integrates both injectables and lasers to achieve outstanding results tailored to each individual. Beyond his clinical practice, Dr. Lim is recognised as a key opinion leader for pharmaceutical and medical device companies, including Allergan, IBSA, Lutronic, Cynosure, and Lumenis. Through his leadership and expertise, Dr. Lim continues to shape the landscape of dermatology, providing innovative solutions and transformative outcomes for his patients worldwide. Here to discuss diagnosing skin pigmentation and the role of energy-based devices in treatment for Cynosure Australia, today we welcome Dr. Davin Lim. Welcome to the podcast, Dr. Davin Lim. It's such a pleasure to have you with us today.
Thank you very much for asking me to be involved in this podcast. Yeah, looking forward to it. And one of my passion topics, which is pigment.
Yes, absolutely. But before we delve into that topic, you are an extremely accomplished dermatologist. You clearly have a passion for what you do. It comes through in everything that you do and say. For those out there that don't know who you are, can you please tell us a little bit about yourself and how you actually came to be in the aesthetics industry?
So I started off as a general dermatologist, finished my dermatology training. Actually, I was trained in the UK, Ireland, finished my training in Australia, but also I did some stints overseas in the US and in Asia as well. And then from there on, I guess I just found my niche in the aesthetics field, especially energy-based devices, lasers, but I also do a lot of injectables as well. But obviously, as a derm, we have to have our bases with medical dermatology. In other words, just the bread and butter about how to treat skin. And then from there, I guess it's quite easy. Once you understand how to treat bad skin, you can make mediocre skin really good.
Oh, I like that. I love the way that you're just straightforward, make bad skin good and mediocre skin great. In the industry, we know one of the most challenging topics and one of the most challenging concerns to deal with is pigmentation. There are various types of pigmentation. Give us a rundown. What are the types of pigmentations? How do they manifest?
I guess pigmentation is a big umbrella that describes a whole heap of different conditions. And when you look at pigmentation, there's about 150, 160 causes of pigment, everything from genetics to simple things like freckles, sunspots, and obviously things like skin cancer, but they can also be hormonally driven, genetically driven, drug induced. That's a whole heap of stuff. And how we break it down, I guess for me, it's like, is it genetic? Is it acquired? Is it a combination of both? And once you can understand pigment, you don't have to actually know all the other, all the 150 different categories. But when you can get a rough idea of pigment, that way you can treat it effectively. So I always say, if you're not too sure about pigment, right, try not to hit it with a laser, because in certain skin types, like darker skin types, it'll hit you back. So some pigment, for example, like melasma, if you hit it with a really high-powered laser or hit it with a strong chemical peel, instead of getting it better, it'll always hit you back and pigment will rebound back. So
Mm.
try to get an understanding of pigment, especially in different skin types.
Yeah, for sure. A big problem in our industry is recalcitrant pigment and how to treat it and what to do to avoid it in the first place. But can you actually explain, now you're talking about different types, melasma versus, freckles and so forth. What's the difference between epidermal and dermal pigmentation?
Now, most of pigment you can I guess categorize it on how deep it is. Epidermal, generally speaking, not always the case, generally speaking, is easier to treat, right? And then dermal pigment is harder because dermal, as the name suggests, is in the deeper layers of skin. So what we want to do, especially in darker skin types, we want to bypass the epidermis and hit the dermis, which can be tricky because there's only a few devices that can do that. And then when you have mixed pigment, obviously epidermal and dermal, which, for example, most of melasma is, that can get tricky as well. So to understand the depth of pigment is pretty important. You can eyeball it and you can have a look and go, oh, this is a little bit brown. So chances are if it's brown, it's mainly epidermal. If it's grayish, it's mainly dermal. But obviously you can have a mix of both. Now, from there, not all epidermal pigment can be easily treated. For example, things like birthmarks. Birthmarks are often like things like your cafe au lait macules and your brown birthmarks. They're often epidermal, but they can be tricky to treat because once you have a genetic drive behind that, they're usually recurrent or recalcitrant. Whilst things as simple as sunspots, especially in lighter skin types, whether it be freckles or lentigos, they're a lot easier to treat.
And you were talking about, the different types of pigment before. How significant do you think inflammation is to pigmentation? And
Yeah.
do you only treat the pigmentation or do you also treat the inflammation?
As the name suggests, PIH, post-inflammatory hyperpigmentation, is super common. So look, how I try to put it simply is that if you have inflammation, if the skin goes red, chances are it's going to go brown after. So whatever the cause of redness, so for example, it can be things like pimples. Once you look at the skin type, so the darker the skin type, the increased incidence of PIH. So someone who's Caucasian, light skin type, chances of PIH is low. Certainly, if they go out in the sun, if they do something silly like get sunburned, then obviously the chances of PIH is higher. But as you go up to the skin types from 2, 3, 4, 5, 6, your chances of PIH goes up and up with each skin type. So
Mm.
it's almost universal. Once you have skin type 3 and above, like for example, like Asians like myself, skin type 3 and above, it's almost universal. If it goes red, it's going to go brown. So whatever the cause of red, so the red could be as simple as a pimple, right? Or can be complex as an autoimmune condition, or as common as something like an insect bite or trauma or something that you've done to the skin, even a strong chemical peel or a laser burn. So how it goes is this: if it's going to go red, if you've got darker skin types, try to mitigate the post-inflammatory inflammation first. Treat the inflammation prior, because once you treat that, the chances of post-inflammatory hyperpigmentation markedly goes down. So one of the tricks we do, apart from your strict photo protection using your sunscreens and all, we whack on some really strong steroid. And dermatologists aren't afraid to use steroids, so we might use a really super potent corticosteroid, maybe 3, 4, 5 day applications, even extending for a week, and we're super comfortable with using steroids on the face because that mitigates post-inflammatory hyperpigmentation. Much easier to treat inflammation than hyperpigmentation.
Absolutely. How would you do that for example, a patient that's had surgery? Would you use cortisone or steroids in that case?
Yeah, in surgery, what we try to do is, I mean, the first thing is if you're looking at surgery and surgical scars, early treatment and mitigation of scars is super important. And sometimes as something as simple as tape, you see surgeons, we use tape a lot. So you tape the area, especially if it's on the face, because tape, first thing it does is photo protects, right? So it decreases your chances of, induction of pigment from light sources.
Mm.
And then sometimes it can be as easy as just using silicone. And silicone can reduce inflammation, then you can modulate the environment of your wound a lot better. So things as simple as your Strataderm, your Dermatix, your silicone tapes, super easy. One thing which is a caveat is that Australia doesn't have what's known as steroid impregnated tape. And for me, for example, early cesarean scars or early surgical scars, I get patients, it's just because of our silly TGA regulations here. We can't get a lot of good stuff from overseas. But the great thing now with the internet is that I just give them a link and they just buy some tape from Japan.
Oh, wow. And they can do that.
I can do that, and that's really good for early scarring. So you'll before they become truly hypertrophic scarring or well before keloid scarring, steroid impregnated tape, super cheap, super easy, and you might want to use it for 4 or 5 days in a row and give yourself a week's break, and that really mitigates the inflammation as well, which may cause raised scars, but it may cause some post-inflammatory hyperpigmentation as well.
Yeah, right. That's a great tip, Davin. And the other thing that I heard the other day was hit it hard with fractional or Fraxel a couple of weeks after surgery. Is that controversial?
There's a good consensus which was published about 4 years ago, and Greg Goodman was one of the authors, and my good friend Afia Atzi was, I think, the lead investigator. So now we know hit scars early with lasers. It's kind of easy to understand because if it's red, see when you press down on a scar and you can see you can get the gut feeling. If you blanch it and if there's pigment at the back, the chances are you'll benefit from a fractional laser. If you hit it and then you can understand that's red, chances are it's going to benefit from a vascular laser. So
Right.
generally speaking, for red early scars, we try to hit it with something like a vascular laser first. And then when we want to remodel scars, we may use a fractional laser. The fractional laser, there's so many different, your non-ablative, ablative, and there's many different wavelengths. And early remodeling of scarring helps a lot. But like I said, you start off with simple procedures, simple methods like your tape, your silicone, your steroid impregnated tape. Those are simple, cost-effective ways that you don't need to see a dermatologist for plastic surgeon to try to reduce the scars.
That's such good advice. Thank you so much. Now, as a dermatologist, how do you actually diagnose the various types of pigment that there are?
Okay, common things occur commonly. So, like you suggested, post-inflammatory hyperpigmentation, super common. Melasma, super common. And then from there, you can look at, and for example, patterning. Freckles are very easy to diagnose, right? Lentigos are easy to diagnose. So lentigos, you can see whether is it flat, right, like a true lentigo? Is it slightly raised with textural change, like a macular subkeratosis? So those are the super common causes of pigment.
So you're talking about light-based devices, lasers, when treating pigmentation. Can you elaborate on the role of that and how you would use it and maybe some more avant-garde ways of using it? We're talking about melasma, hitting it hard and high is bad, but is hitting it low and often good?
Yeah, so I guess when you're looking at light-based devices, we'll categorize it as things like, for example, like IPL, right? So IPL is an energy-based device. It's not a laser, but it's energy-based. So your intense pulse light, your broadband light, and there are many different makes. Your quantum IPLs, your Cyton BBLs, your Forever Young, your Hero. There's so many different varieties, and Candela makes some good ones as well. But using those can treat the majority of people, not melasma pigment. Melasma is a little bit harder because for melasma, what you don't want to do is create too much heat, right? So you want to actually, when you treat melasma, it's a very precise treatment. So when it comes to common causes of pigment where it's not melasma related in someone of lighter skin types, certainly something as simple as IPL or BBL can help. When you're treating darker skin types, that's where it gets really tricky. Because if you get your parameters wrong, if you use the wrong wavelength, the wrong pulse duration, the wrong device, like I said, pigment can hit you back. So if you're going to start off with pigment, start off with lighter skin types, easier skin types. Diagnosis is well known. Don't start off with melasma. For melasma, what you want to do is one of two things. You want to slow down the pigment production, and that's using the things like your Q switch lasers. Or if you want to hit pigment, in other words, blow it up eloquently with something like a pico laser, where you want a lot of energy in a very short period of time with minimal to no heating. So you want what's known as a photoacoustic laser, right, rather than a thermal laser.
I love that. I love how you've explained that so eloquently. We actually have so many devices in this industry. Sometimes it is mind-boggling. I was speaking with Cynosure earlier, and we were talking about all the different devices that there are out there. And I'd love a rundown of the most common ones you use, and which ones you think are the most appropriate for each skin type.
So we talked about IPL, BBL, right? So those are really common. Those are entry level. They're still very important. We still use it, even though I call it entry level. We use it
Mm.
day in, day out, and they're great for things like like freckles and all in your lighter skin types and just general pigment. So general rejuve and lighter skin types, IPL, BBL. That's cost effective for the clinic. They're cheaper to buy than something like a pico laser. However, they do have their limitations. They're very tricky to use in darker skin types,
Of course.
and they're extremely tricky to use in melasma, right? There's only one or two people in the world who execute that well. And so they're very tricky to use, especially when you're treating darker skin types, and they're less forgiving compared to lasers.
Leaders, innovators, developers, and best-in-class creators of energy-based aesthetic and medical treatment systems, Cynosure develops and manufactures a diverse range of leading treatment applications for hair removal, tattoo removal, skin revitalization, scar reduction, women's health, body contouring, and more. Always one step ahead of the industry, their innovative products are used by practitioners, physicians, and aesthetic business owners worldwide to enhance their offerings and provide cutting-edge treatments for their patients. In addition to laser and RF technologies, Cynosure Australia also provides marketing, clinical, and technical support services. Learn how Cynosure Australia can help you grow and succeed. Contact the team at www.cynosureaustralia.com today.
Then the next category after that's the older lasers, what we call the pigment lasers, which are nanosecond lasers. They're called Q-switch lasers. And years ago, there used to be things like the Q-switch Ruby, but now you have Q-switch, your 532, 1064s. And they're the lasers which can help with general pigment. So you can treat things like lentigos, but once you treat darker skin types, right, once you're using the older technology, they're less forgiving because they may create too much inflammation. And as you pointed out, inflammation may create post-inflammatory hyperpigmentation. So the Q-switch lasers, though they are very useful in lighter skin types, they have less of a role to play in darker skin types in treating melasma. And then you go up to the newer generation devices like your pico lasers. And the pico lasers are the ones which produce, like I said, a lot of energy in a very short period of time. So these are technologically advanced lasers because the amount of heat generated and the amount of inflammation as compared with older devices, much less, right? And when you decrease the amount of thermal load in the tissue itself, you decrease all the other side effects like post-inflammatory redness and hence post-inflammatory hyperpigmentation.
Now let's talk results because it's so varied with the different types of pigment. What can we expect if we treat it well and we treat it smart? What can we expect in terms of results and how long would they last?
So one thing which I tell to a lot of listeners and when I lecture, sometimes it's not about results. In fact, when you're using pico lasers, it's about mitigating the side effects, right? Because
Right.
if you use an older device, for example, like even the Q-switch device on darker skin types, often if you know what you're doing, you can tune the laser with the results just as good, sometimes even better than the new generation device. The caveat is that when each time you treat the patient, you roll the dice of side effects. So the side effects are really high. So when you look at the papers using the older devices, right, your side effects may be as high as 40%. So just imagine you treat 10 people, and six of them you may get brilliant results, and four of them absolute disaster. So the whole idea is to actually treat patients, but get good results, but mitigate the side effects. And when you're using newer generation devices like the pico lasers, your side effect profile, I think even if you follow standard operating protocols, probably about 3%, 2-3%.
Wow.
So
Very
remember,
low.
yeah, very low. So remember, not all lasers, right? There's not one laser that has no side effects. So you want to actually get the most predictable results, but the flip side is you want to mitigate the side effects.
Mm.
This is where the pico lasers come in. And generally speaking, if you dial it in, your results are very, very predictable. Melasma, it's probably the best laser to treat melasma because, like I say, the amount of heat generated, if you know what you're doing, the amount of heat generated is very, very low. So it won't get all melasma. It'll get the hit rate's about 85% if you know how to use it, especially if you combine it with medical therapy, which is very, very high because when you look at melasma, your hit rate in the past used to be about 20 to 40%. So suddenly with the new generation devices, providing you tune in the settings and you understand how to treat melasma, the hit rate's about 80, 85%, which is extraordinarily high. And your side effect profile is very low, 2, 3% at most.
That's mind blowing. I didn't actually know it was that high. And then with melasma down the track, it's always going to be sort of a problem if you've had it before.
Absolutely. So
Chances
like,
are you're going to have
yeah,
it again, right?
yeah, yeah. So melasma, I mean, they always say it's a very humbling condition because what you some cases respond, some don't. So sometimes it humbles you when it comes to initial treatment. But then how I explain to patient, melasma is just like any other medical condition, whether it be high blood pressure, diabetes, thyroid disease. Generally speaking, they all need some kind of maintenance therapy. When you see your general practitioner, you've got high blood pressure, they put you on, lifestyle changes, right, which is super important when you're treating melasma, like for example, your sun protection. But they may put you on the medication for blood pressure. But when you stop having that medication or stop having treatment, your blood pressure may go up again. So
Mm.
the whole idea with melasma is the same thing. We may treat you using energy devices, medical therapy, but it may come, it may go, and then sooner or later the condition burns itself out, which is very good.
Oh, that's good. Something to look forward to, I suppose. You are one of the foremost innovators in our industry. Tell us some gems. What's new in the world of pigmentation and lasers? Can you give us any updates?
I'm lucky enough to work in a group, which means we have lots of lasers, lots of pigment lasers, lots of pico lasers from different brands. And even within the same brand, we have many different lasers itself. So
A lucky guy, you get to play.
we get to play, and that's part and parcel of learning, isn't it? Not every company will have the best device. Much what I say with cars, you can't have one car company that makes the best cars for everything. You can't have a sports car company that makes really good four-wheel drive or very
Yeah.
good luxury sedan. They all have their purposes and they all have their niches, right? So you're not going to use a Porsche 911 to go off-roading, and you're not going to use, an off-roader to go around the track. So it's the same thing. They all have their niches with it. So what's happened in the recent past few years is the development of pico lasers, which are the short pulse duration lasers,
Mm.
and they offer much safer treatments compared to the other pigment lasers. So if you're treating pigment, if you're serious about pigment, that's the one. That's where we're heading, right? There are exceptions, and when we're treating, things like your cafe au lait macules and your lentigos and lighter skin types, maybe the old-fashioned nano lasers, the Q-switch lasers, still have an important role. But when we're treating things like your melasma, your pigment, especially diffuse pigment in darker skin types, there's no two ways about it. The pico lasers are the future. They are the future, present, and that they will improve, and they're the future of pigment treatments. They
Mm.
do far more than just treat pigment because the fractionated devices actually increase the amount of collagen production using fractionated energy devices or fractionated beams of that particular wavelength. And that's a very nice way of increasing your collagen production, but at the same time, decreasing your side effects such as post-inflammatory pigment.
Do you feel that those lasers have an effect on the tone and color of the skin? Could they potentially remove a bit of the pinkness from that beautiful pink flush from the skin, or change vascularity at all in the skin? Have you noticed that?
Yeah, so I mean, so to answer your question, when you look at the science behind pico lasers, they target your chromophores melanin, right? What it does is, I always say it's like changing the different palettes in your skin. But by decreasing the amount of brown, in fact, my partner Van and I were just talking about this morning because we just finished a presentation 2 days ago. As an injector, she notices that with lasers, right, what we do is when you change the palette of the skin, your light reflection is a lot better. So that's hers inject. For me, I'm a simple bloke. So I go, mate, it's like a car door. You got a white car door and you got shit all over it, right? Where you got dirt and you've got rust. You polish the car door, you remove the brown, you remove the rust. The car door, the white car door is so much nicer, right?
Mm,
So it's the same thing when you're asking me about redness, right? And background erythema and maybe that rosy, healthy glow. If you
mm,
have the melanin pigment or sun damage, once you remove that, your whole palette of your skin changes, right? From an injector's point of view, that gives you the radiance and reflectance of light, which perceivably improves your light reflex. And
mm,
as a result, it almost highlights your work as an injector because the volume changes are perceivably increased. It doesn't increase volume itself, but then
no.
light reflectance, especially, when we're doing injectables, it's what we're doing is changing the light reflex. We're improving, like for example, the apex of the cheek or the swoop of the zygoma using soft tissue injectables. Lasers don't do that where it increases the volume, but it improves your perception of volume, right?
Mm,
So the answer to your question is that it improves the redness, not by modulating the redness, but by decreasing the brown. And the whole
mm.
reflectance of light and the whole palette of your skin and your skin texture itself and your skin quality improves.
Mm. I have heard, I love what you've just said and how eloquently you've put that. A lot of makeup artists out there who are listening will know about light reflection and using makeup to have that effect of the light and dark
Absolutely.
and shadow. And I think what injectors do, and I know my injectors do it so well, is they've got that beautiful artistic eye, and then you can create and mold, sort of someone's face to show off and enhance those features. But using the lasers obviously will also do that.
As many patients would know, especially around your under eye area, your mid cheek area, when you have that area of pigment, that almost looks like you have a groove over there, right?
Mhm.
Very different from your zygomatic rectangular on your mid cheek groove. That was a true groove. But then when you see there's a lot of patients out there with photo damage, and you look at the contrast, when you remove that pigment over there, the whole mid face improves. You haven't changed any volume changes, but what if you improve the quality of the skin? So that's what lasers do. It really highlights the work of injectors. It highlights the work of makeup artists, and just improve the quality of your skin. Just like no makeup.
Yeah, I love it. And multimodality, are you a big fan of using different types? You were talking about injectables, mixing that with, obviously enhancing a person's features after post laser. What do you do? Tell us how you mix your modalities and what you like to do.
Yeah, so I mean, I guess when you look at mixing modalities, you can mix modalities using different lasers, different energy devices. You can mix modalities using injectables, and you can mix your modalities using skincare, right? So when it comes to mix modalities using lasers, for example, if someone has got more textural change where you want more collagen production, you might mix a pigment laser with something like a fractional laser, something which goes a little bit deeper. So that's one example, right? The example of mixing injectables, I often use injectables to enhance the effects of laser. So that might be your hyaluronic acid injectables, it might be your collagen stimulating injectables, or maybe a new one like the polynucleotide,
Mm.
which improves your skin quality as well. And then last but not least, which is very important, as a dermatologist, we use a lot of skincare, right? So we may use things like, for example, your vitamin A's, your retinols, your retinoic acids, your ascorbic acids, your oxalic acids, and never underestimate the role of skincare, especially when combined with lasers, especially when you're treating pigment, because skincare is very important.
Preaching to the choir, I'm a cosmetic formulator, so I hear you exactly. Skincare is, people say it's an add-on. It's actually a fundamental. You really
It,
can't go, even especially when you're treating pigmentation. You need your tyrosinase inhibitors. You need your supportive skincare.
100%. So when I go to all these laser lectures, they ask me for my parameters, and I'll tell them my parameters. But the problem is that they don't realize it's not just the parameters. Sometimes the skincare is equal, if not more important than the parameter that which you have on your laser itself. It's like your modulation of inflammation from the laser itself, whether it be short term or intermediate term. And then, like you say, your tyrosinase inhibitors. how to titrate that, when to titrate that, what to use, what percentage, what can we combine it with, how important are antioxidants, how important is the attenuation of blue light, HUV light with your iron oxides, right? All that sort of stuff, your photoprotection against UVB, UVA, what wavelengths, those are equally important, if not more important than the settings itself.
Good stuff. I tell you what, it's exactly what we want to hear, because we have been preaching to the industry for so long. If you're from the dermal sector of the industry, I believe all of our sectors have converged so beautifully to create such an incredible array of treatments that when combined, you can get some spectacular results. Davin, what's the future of our industry? What do you think you're going to see 5 years from now?
So what's coming up in the future is AI. It's AI. So I've just cloned an avatar of myself, and
Did you?
I did. So and it's super scary because you cannot tell the difference. Even I've done voice cloning, and I've done myself with video cloning as well. We're limited by what we can do sleep wise, time wise. But if you can clone yourself, holy moly, that's so good. So for me, it's AI, and this it's just the beginning. It's just the beginning of things.
That's insane. What would your clone self do?
And my client self is exactly like me. I can't tell the difference. It's seriously.
Am
I
I speaking to a clone right now?
No, but if I give you a clone, you will not be able to tell the difference. Seriously, you won't be able to tell. I could not tell the difference. I've sent it to my family, my friends, to my partner. They can't tell the difference. It's impossible to tell the difference.
That's crazy.
That good.
Well,
So
hope,
now,
hope your AI doesn't go rogue on you.
no. We've still got control of that. But yeah,
I love it. Oh my goodness. Please come back and give us an episode about AI and
yeah,
about
we'll do.
cloning and about the future of our industry, because I think that's the most outside of the box answer I've received of late.
You know why it's so scary? This is why it's so scary, because now information is available at our fingertips, right? So if we want to write, a synopsis on, for example, the role of antioxidants in skincare, you can ask ChatGPT, and they'll come up with, like you say, a very eloquent way, but a very scientifically accurate way of describing antioxidants in skincare. Then you can actually have a clone of whoever. So you can even have a 17-year-old girl or 16-year-old girl who wants to be a skincare expert. She can clone herself. And she doesn't have to pronunciate all these words. The clone can actually understand those words and come out with a synopsis, which is better than what I can give. I may have an and an here and there. I may mispronounce one word, or I may not be able to get it out as quickly as what the clone can. And suddenly you have yourself a 17-year-old girl can beat a dermatologist at giving skincare advice. And that's how scary things will be.
That's mind blowing. Davin, thank you so much for coming on a podcast. It's an absolute pleasure. You're incredible. Please come and visit us again.
No worries. Well, thanks for that.
You've reached the end of another episode of the ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.